Is it inflamed? In which case that person might actually benefit from an anti-inflammatory or steroid approach. Or if it's degenerative, then they're not going to really get much out of an anti-inflammatory, and they really need to go down a regenerative path. So I may do a steroid injection at first just to see if that calms things down. If the problem goes away, the patient's happy, life is good. But if you do too many steroid injections, you're going to weaken or damage the tissue. So the trick is to try to figure out if the patient needs regenerative techniques. And if they do need regenerative techniques, then you move into the regenerative model. Now that model involves several different recipes and different strategies. And part of it comes down to how bad is the damage? Do they need major tools to fix the problem, or is it a relatively minor problem? So that's a lot of our work is trying to sort out based upon a thorough physical examination. When I press and pull and push, and what's tender, where does the clicking, popping happen, what is a tendon snapping over something? So we spend a lot of time examining those structures. Then we look at the MRI scans and ultrasound studies and things like that to try to understand what's going on biomechanically. And once we sort that out, then we try to pick our recipes of various strengths to achieve a goal.
So number one in the algorithm, in your mind, classify. Your classification is degenerative or inflammatory. Inflammatory, the things that work well on patients, steroids, non-steroidals, injections, corticosteroid injection. Degenerative, going down the path of regenerative medicine for that purpose. Now, subcategorize the